Welcome to the Fertility Now channel. My name is Lorne Brown. I'm the Clinical Director of AcuBalance Wellness Center in Vancouver, British Columbia, Canada. I'm a doctor of traditional Chinese medicine, a fellow of the American Board of Oriental Reproductive Medicine, clinical hypnotherapist, and a certified laser therapist. And I wanted to talk to you about AMH, anti-Müllerian hormone. And I want to make this as simple as possible. So rather than going into the biology of AMH and a lot of the science of AMH, I want to focus on just the clinical relevancy of AMH testing for you. First thing I want to share is AMH is a quantity test, not a quality. And to make a healthy baby, it's all about quality. You just need one really good egg, have that in a natural conception. And if it's good quality and it's got good, and there's good sperm quality and a good uterine environment, that can turn into a healthy baby. AMH is not testing quality. I just want to make that clear because when I consult with women in my practice at AcuBalance, they're quite stressed, concerned when their AMH tests say it's low for their age or just low in general. And I want to remind you that it is a quantity test. So what's the relevance of this test then? Really, it's being used in the fertility world at this point, at this time of recording, as a predictive value for how you may respond in an IVF setting, as in the quantity. How many eggs will we get from your follicles? How many eggs will we get if we do an IVF setting? And the reason it's relevant to test AMH is if you're thinking about IVF, but you're not sure, and you're continuing to try naturally, and you find out your AMH is low, this may be an indication that you want to accelerate that process of visiting or doing an IVF cycle because of your egg count. It's diminishing, hence the diminished ovarian reserve. So that's one of the reasons people will test AMH. If you have no desire to do an IVF, meaning it's not in your cards, you are not going to do an IVF. It's natural or not. Natural as in you're going to either conceive natural or you're not going to continue to try. There is no IVF because of spiritual, religious, or financial reasons. Then there may not be a benefit to testing your AMH because if you're ovulating monthly and you're releasing that one egg because you're ovulating monthly, then there's probably not a great benefit for you to test your AMH because it is just a quantity test. And really its benefit, its value comes into play if you're thinking or IVF is something you would do, but you just don't want to do it now, or you're thinking of starting a new career and your AMH is low. That is basically telling you that you don't have the luxury of waiting too long or waiting at all. And so that's one of the main reasons or why you would test AMH and what it can tell you. I do want to emphasize here that I don't like to look at any one test or sign or symptom in isolation. And this comes from my paradigm of practicing Chinese medicine. So in Chinese medicine, your Chinese medicine diagnosis always comes down to what's called a pattern differential diagnosis. They're like syndromes. And no one sign or symptom or test is enough. It's like looking at a puzzle. If you have all these pieces of a puzzle and I just pick up one piece, I can't tell what the picture is from that one piece, from that AMH test. But if I start to get several pieces and I start to put them together, even without having put all the pieces together, or even without having all the pieces, if I have enough of those pieces of the puzzle, I can see what this picture is going to look like. And so with enough signs and symptoms and enough tests, different types of test results, these are each of my pieces of the puzzle, I can get a picture of you and see maybe what are some of the underlying causes behind your infertility, and also how to develop a treatment strategy to optimize your fertility to conceive naturally or through an IVF setting. So AMH is a piece of the puzzle. It doesn't give you a complete picture. It's based on ovarian reserve. If your AMH is low and you haven't done so, I would encourage you then to visit your reproductive endocrinologist and ask if they will do an antral follicle count. It is just an ultrasound where they look at each of your ovaries and they will count to see how many antral follicles you have. So follicles that they could stimulate in an IVF cycle. And now with your AMH test and your antral follicle count test, it's again, just quantity here, not quality. Then it gives you an idea of how you may respond, how many eggs they may be able to retrieve in an IVF setting. And that will help you plan whether you think you may need one or more IVF cycles, and also set up that expectation of how many to expect if you did that IVF, because it can be quite discouraging or disappointing if in your mind you think you should have 15 because you see on the internet some women have 15 eggs and you have a low AMH and an antral follicle count, say, of 6. Well, it's not likely you're going to have 15 eggs retrieved in your IVF. You're likely going to have 6 plus or minus 3 or 4 eggs retrieved in that IVF cycle. So I just want you to keep that in mind. Also, when it comes to quality, not quantity, but quality, there are things that you can do to support the environment in which your follicles mature in, whether you're trying to conceive naturally or whether you're thinking of doing something like IVF. And so on the AccuBalance website and on this channel, Fertility Now channel, we're sharing some information for you, lots of things that you can do. For example, the fertility diet. We have the AccuBalance fertility diet available for download for free from the accubalance.ca website. So the diet plays a key. And these things I'm sharing with you are quite simple, so simple they're easy to be dismissed. But if you're doing this over a long period of time, several weeks and months, eating this way and living what I'm going to share, then this will impact your body on a cellular level, which your egg and his sperm cell are cells, and you can help impact so that egg and that sperm reach their peak fertility potential, whether you're trying to conceive naturally or through an IVF setting. So the fertility diet, which you can download from the website at AccuBalance. Lifestyle, exercise, so moderate exercise, adequate rest, sufficient deep sleep. It's really important that you're getting the sufficient deep sleep. Then there's things like you can add like supplements. At our clinic, we do nutritional IV therapy. These are IVs that bypass the gut so we can get it into the blood right to the cells. Acupuncture, laser acupuncture and photobiomodulation for fertility, mind massage. So there's many things that you can do to increase blood flow to your reproductive system, to provide the nutrition that your eggs need, to reduce inflammation. There's so many things that we can do to help optimize so we can work on the quality side. And so if your AMH is low, but yet we help with that quality, so your egg reaches its peak fertility potential, then if you're trying naturally, we just need that one good egg. And if you're doing IVF and you have low AMH, even more important now to make sure we reach that peak fertility potential, that we really help maximize your egg quality, because we're not going to get those 15 eggs hoping we have 2 to 4 good eggs that can turn into babies. You may only have 3 or 4 eggs retrieved. And so now quality is really important because we don't have the luxury of many eggs to choose from, hoping that we get at least one good egg. And so focus on the quality, and there's so many things that you can do. And if you go to the AccuBalance website, there's a list of blogs that we're constantly sharing information for you. What happens if your AMH is really high? What happens if it's the other way? Well, first of all, that's a good sign in that there's a good ovarian reserve there. It still doesn't mean that you have the quality. It just means you have a lot of eggs. And in our practice, it's not a diagnostic criteria for PCOS, polycystic ovarian syndrome. However, it is something that has been, there is a correlation between high AMH at a certain level and PCOS. And so again, it doesn't mean you can't diagnose somebody as PCOS because they have high AMH, but if their AMH is high, it would make me make sure I look into those kind of tests to rule out polycystic ovarian syndrome. And other than that, I'm not going to tell you what is considered low, what's considered high. Every lab is a little different, and you'll see on Dr. Google, everybody has a little different idea of what's considered low or high. So what I'd recommend is in your local area, if you're visiting an IVF clinic, because they have a lab that they regularly use, find out what they're hoping that your AMH is for an IVF cycle. Or if you're visiting, like here at AccuBalance in Vancouver, the 2 labs that we use a lot in Vancouver, we're familiar with their ranges. And so we're able to consult with you, counsel you about what your range is for your age and for that actual lab. So I hope I made this simple for you. And I want to wish you the best of luck on your fertility journey.